Here is another case, which will start out by showing a abdominal CT scan in which the arrows are pointing to areas in the liver which are not only translucent, but they are sausage-shaped. They can perhaps be dilated ducts rather than generally circular metastatic areas. In addition, with this being the left lobe of the liver, and this perhaps being the gallbladder fossa, and this being the spleen, and probably most of this being the stomach, the pancreas is generally irregular and denser than it normally should be. Let's take a look at the head of the pancreas in this case, in which we could see that out here you have sort of a lobular configuration like you should see in the pancreas. All of this is generally lobular out here, but this part here is not lobular. And not only is it not lobular, but it appears sclerotic. And not only is it sclerotic, but it appears like these fibrous areas extend not only into adjacent pancreas, but also into surrounding fat. And let's take a look now at the microscopic slide of this case, in which we can see, if we perhaps move down or move up and zoom up to this area, I will have no trouble convincing you that these are generally nice lobules of the pancreas. Here are some intralobular ducts. Here are the actual lobules. Here's a group of acini. There might be an area here that is a little more fibrotic than usual. There's no cancer at all within this part of the pancreas. If we move over, however, more towards that fibrotic or sclerotic area, I'm going to show you a beautiful side-by-side comparison here of a totally normal lobule with acini, and as well as an area in which the glands are irregular and infiltrative and dark. And all of this stuff here is adenocarcinoma of the pancreas. There's no doubt of the diagnosis. Up here, it's all normal pancreas. There's no doubt of that diagnosis. And here, there's no doubt that there's some chronic inflammatory cells spattered between the two areas. Let's take one or two more closer looks at the malignant glands, however. You could see that for all the right reasons, they are very dark, they are very irregular, they are very invasive. Some of them are as glands, and some of them almost look like they're just individual cells. But in addition, here's something that you should notice as well. This group of glands or cells is surrounding an actual nerve, and you should not have any epithelial cells surrounding or encompassing or trapping nerves unless it's metastatic cancer. And that's exactly what we have here. Notice here's a tumor cell that may have a big vacuole inside of it, and it looks like it's infiltrating the stroma as an individual cell rather than as a gland. And should we go to another area just to show you some more of this stuff? Yeah, this is malignant as all hell. Look at that horrible, bizarre cell. Look at these haphazardly infiltrating cells. Look how sclerotic the intervening stroma is. All of these areas here, are little infiltrating nests of poorly differentiated glands. All the rest of this whiter stuff is stroma. Pancreas carcinoma classically, routinely, evokes a very, very dense fibrous stroma. It is very desmoplastic. It evokes a big sclerotic response, just like breast cancer does. And these have all the classical features of pancreas carcinoma, ranging from the totally normal lobules that we have out here nice and contained by these little septae between the lobules, having all the features of normal glands, all the way to this area out here, in which you see horribly malignant, irregularly infiltrating glands, evoking a very, very dense, fibrous response, sometimes infiltrating as glands, and sometimes, like perhaps here and here, and here and here, infiltrating as perhaps an individual cell or two. Thank you very much.